protecting the public, the Trump administration considers whether to require people to wear face masks when they're outside. Coronavirus and the campaigns. An update on the race for the White House, including whether a state primary next week will go on as planned. And reaching out. As masses around the world are being celebrated without the faithful, one priest tells us how he's keeping in touch with his flock. On EWTN News Nightly for Friday, April 3rd, 2020. Good evening and thanks for joining us tonight. I'm Tracy Sable. The Trump administration is considering a plan to ask Americans to wear facial masks to help slow the spread of coronavirus, especially in hard-hit areas. The news comes after another record day of new cases. Correspondent Owen Jensen reports now from the White House. Owen.
Here at the White House, Tracy, they're talking new facial covering guidelines. Across the globe, more than 1 million people have been infected by the coronavirus. Nearly 60,000 have died.
Businesses closed, people home, social distancing. Still, the insidious coronavirus finding its victims. This New York City nurse knows the virus firsthand.
One of the first things you realize is that everyone who has this, it comes differently for everyone. Like when I had it, I didn't really have a cough. My lung sounds were clear pretty much the whole time. But I had a fever. Like I just had a constant fever.
While many are wearing masks, not everyone is. And now new guidelines with people being told to wear some kind of facial covering if they're going to be around others.
If people wanted to wear them, they can. If people wanted to use scarves, which they have, many people have them, they can. In many cases, the scarf is better. It's thicker.
If you're headed to the grocery store or pharmacy, places are actually still open, a non-medical mask, t-shirts, or bandanas could be used to cover the nose and mouth.
And we don't want people to get an artificial sense of protection because they're behind a mask.
But of course, nothing is foolproof.
Because if they're touching things, remember, your eyes are not in the mask. So if you're touching things and then touching your eyes, you're exposing yourself in the same way.
Meanwhile, more devastating economic numbers. Airport security checkpoints screened fewer than 125,000 people Thursday. The same day last year saw 2.5 million people pass through. Also, half of the people in the world are reportedly on lockdown orders. And while so many are out of work, the Army Corps of Engineers is working overtime to help cities create pop-up hospitals.
We don't have the ability and the time to be able to do it like everybody would like. I'm telling our guys, you got X amount of days, you get the mission essential piece done by the time that mayor needs it done.
Now, those N95 masks, also known as respirators, well, healthcare professionals really need those. They're in short supply, and the company 3M says they'll be making more of those for the United States. Tracy?
Okay, thank you, Owen. Correspondent Owen Jensen reporting from the White House. Senate Democrats are calling for further aid to Americans struggling amidst the COVID-19 pandemic, especially the millions of workers who have filed for unemployment. Republicans counter first lawmakers need more facts around what is working and what isn't. Capitol Hill correspondent Eric Rosales reports.
Lawmakers wrestle over what to do next to help Americans get through this crisis.
We Democrats are going to hold the Trump administration's feet to the fire to make sure they get it done and get it done right. And at the top of the list, the administration must get their unemployment and must ensure that people get their new unemployment insurance checks within 2 weeks.
But the majority leader says we need to let the $2.2 trillion stimulus package work first.
We need to learn more, and we're in that period now. How quickly did the checks get out? Did they make a difference in time?
And the administration says that's already in the works and direct payments are on the way.
I'm pleased to report that within 2 weeks, the first payments will be direct deposit into taxpayers' account.
Today, the minority leader called for frontline workers to receive hazard pay.
I am urging President Trump to sign an executive order that would give these federal workers 25% hazard pay, the federal workers, and I hope that private industry will follow. I hope he does that immediately.
Wednesday, President Trump said he'd support it.
I think it's something we're discussing in terms of bonus or bonus pay. It doesn't have to be called hazard pay.
Leader Schumer is also calling for ramping up production of critical supplies and delivery of those supplies to the crisis hotspots, Both parties hard at work on getting help to all Americans. The majority leader writing, quote, "We are now working with the administration to ensure the resources included in the CARES Act are deployed to families and small businesses as quickly as possible." On Capitol Hill, Eric Rosales, EWTN News Nightly.
Wisconsin's governor is attempting to postpone Tuesday's presidential primary.
People walk into a polling booth with accurate spacing to 6 to 10 feet apart, one at a time, going in and have machines scrubbed down.
Presidential candidate Joe Biden says that he thinks votes can be cast safely. Biden's rival Democratic presidential candidate Bernie Sanders on Wednesday called for the state to postpone the election. Milwaukee's Democratic National Convention has been rescheduled from July to the week of August 17th. Susan Crabtree, White House and national political correspondent for Real Clear Politics, joins me now on Skype from San Diego. Susan, welcome back to the show.
Thanks so much for having me, Tracy.
So, Susan, what do you make of what's going on in Wisconsin, and do you think that we're headed for more of this with other state primaries to come?
I think it's a worst-case scenario situation in a pandemic. You have a vote, election is supposed to be taking place on Tuesday, and actually what's happening is, have the governor is in a very difficult situation here. Democrats are apoplectic out there that he hasn't called to delay the election so far. He did today. It's a very fast-moving situation. He's called the legislature back on it for a special Saturday session, and he's asking them to postpone the election and have it be all vote by mail. And this is a push that Democrats like anyway. Republicans do not like vote by mail. They think it gives Democrats an advantage. And so they've been resistant. He did ask the Republican legislature earlier if they could do an absentee ballot mail, like give everybody in the state absentee ballots. And the Republicans resisted that. So that's why it's gotten to this point. And you're going to have this special session. And it looks like the governor is saying he wants the delay to be able to mail in votes until May 26th.
Well, Susan,
so we have some time there.
Yeah. So I'm sorry for interrupting you, Susan. I also want to add, just yesterday, Democrats announced that they were postponing their presidential convention until August. Can you talk about that? And do you think it'll be business as usual, or will there be a different tone there?
Oh, I think that the whole nation, the whole world right now, obviously, as we're grappling with this, it's going to be a much different situation. Usually these are bonanzas. You have, balloon drops, and you have all the party stars out there. It's very sort of a festive occasion. But this time, it's going to be very touch and go. You have the economy in a free fall right now. Hopefully, by that time, we'll find some stability, both with this pandemic and with how we're responding to it with the economy.
Yeah. Vermont Senator Bernie Sanders is still in the race. How do you think that's influencing the Democratic Party moving forward?
Well, it's interesting that he's not getting out right now. I mean, there's really no path to the nomination for him. So, and even in Wisconsin, even though that election was going to happen, Biden was 18 points ahead. So it's really no mystery who is going to win. But I think people are wondering, it's so much uncertainty across the board in the country right now, that if Biden is a little faltering right now, he's been sort of in this bunker state. He's trying to stay relevant, but he's been having some problems with that, obviously. So Sanders has stayed in. There's also talk of Governor Cuomo getting in. He's denied that. He said he's not running for president right now, which lets the door open a little bit. But yes, I think things are very uncertain right now on the Democratic side.
On a different note, the public is hearing from President Trump every day about the administration's efforts to stop the spread of COVID-19. How significant is that from a political standpoint? What do you think?
The public is hearing every day. I think that these press briefings that the president is having work to his advantage politically, even though you don't really like to talk about that right now with so much that the nation has to be grappling with. He has the bully pulpit. And Joe Biden does not, unfortunately. He's used every mechanism he can to try to have a regular briefing himself from his basement in Wilmington. It's been sort of in fits and starts, and he's had different sort of town halls with nurses and medical experts too, and I've tuned into all of those. But here you have Donald Trump having this press briefing every day. It's commanding huge ratings. He kind of gloated about that over the weekend, which was a little bit of bad form, I thought. But his ratings have been pretty good in terms of his handling of the pandemic. They're coming down a little bit. We saw his ratings his highest ever in his presidency at 49%, and then that was last week. This week it's come down to 47%. So we're seeing a leveling off of that as the pandemic gets a little bit more difficult to deal with, and we see the deaths rise to about 5,000 across the nation.
Well, Susan, thanks so much for your time and your insight. We really appreciate it. Susan Crabtree, White House and national political correspondent for Real Clear Politics. Thanks again.
Thank you, Tracy.
President Trump is counting on Catholics to help him win re-election. His campaign held an online event last night to highlight the launch of Catholics for Trump.
Whether or not you're a person of faith, what he is doing, acting on American values with a bias for action, is helping all Americans, whatever their faith, whatever their community. And it is
Political consultant Mary Madeline is one of the co-chairs of Catholics for Trump, along with Matt Schlapp, who we spoke to yesterday right here on News Nightly, and Newt Gingrich. They are joined by the leaders of several pro-life groups who praise the president for protecting unborn babies. Democratic presidential candidate Joe Biden is Catholic, but he advocates for pro-abortion policies. The National Health Service in the UK is the cornerstone of Britain's welfare state, but it may be stretched to the breaking point. Hospitals are bracing for a wave of critically ill patients. The coronavirus pandemic is reaching its peak across the United Kingdom, and it's putting a strain on Britain's healthcare system. The Chinese city of Wuhan continues to reopen more and more. The coronavirus pandemic started there, and the city has been in lockdown for the last 2 months. Authorities are now easing the restrictions on the 11 million people who live there. The Vatican Secretary of State calls for a spirit of international solidarity and thanks priests for their pastoral creativity. In an interview with Vatican media, Cardinal Pietro Parolin reaffirms the Church's closeness to the faithful. He says this time is giving us an opportunity to rediscover the value of family and, most importantly, to return to God. Father Giulio Maspero, theology professor at the Pontifical University of the Holy Cross, best known as Santa Croce, joins us now from Rome. Father, thanks for joining us.
Thanks a lot.
Can you talk about how it's been for you basically being a professor and a priest only online now? How has that transition been?
It's a challenging transition because you don't have the contact with the people, with the students, and it's tough. For example, in Italy, there is a priest who printed the selfies of the people of his parish to celebrate Mass with them somehow. So we have to imagine a lot, and it's tiring, but also it's wonderful because people need a lot the contact, so they appreciate everything. Just a little bit of contact, it's wonderful for them. So it's also interesting.
Father, can you talk about the pros and cons to maybe offering Mass, a meditation, or even a group Bible study online?
So there are different parts, because for this Bible study group is good. It's like a lecture, so it works somehow. Even people is more attentive because you can look at the faces and this kind of good sharing. They can ask questions in an easier way somehow. They feel free to ask, but at the same time, for the Mass, it's completely a problem because you can listen, but you cannot participate. You cannot receive the Holy Sacrament. So there is also a strong feeling that we are missing the most important part. But maybe also is a good opportunity to discover the gift of the Mass, the gift of liturgy here. It's maybe a kind of preparation. So we are relearning, we're learning again what we learned as kids, and we are discovering again what we have.
I know this is a really challenging time for you, but do you think that young people maybe better respond to this way of living in the faith?
Yeah, I think that it's a very interesting moment from that perspective, because young people, they are stuck at home with a lot of time, and they're asking big questions. So I spend all my afternoons and even some mornings talking with people, and also the social medias, and so they feel comfortable in that environment. And for us, it's an opportunity, even if I think that after that, after the crisis, maybe we will be back to the analog world and drink beer together and talk and hug each other again. And we need that. So people also are longing for that. Yeah. They're discovering also what we had, we will have again.
Absolutely. Father, last question. Do you think that priests will continue to use technology as a means to evangelize and maybe educate more in the future?
I think so, because we are learning a lot of, we are discovering tools, we are learning a lot how to use these tools. And maybe also is what Pope Francis was saying, that we have to preach also on the net somehow. We have to learn how to stay there in the digital world. But this could be just the beginning, the starting point. Then the real meeting is needed. So also we will be more able to attract people to a real encounter with Jesus and with the liturgy, with the sacraments. So I think that it's a very interesting opportunity.
Well, Father, thank you so much for joining us, and thank you for your insight. Father Giulio Maspero, theology professor at the Pontifical University of the Holy Cross. Thank you, Father.
Thanks a lot. Bye-bye.
Coming up, as New York battles to fight the coronavirus pandemic, one priest there is asking for 3 days of prayer and fasting. Pope Francis has named a new bishop for Belleville, Illinois. Father Michael Mcgovern was announced as the new bishop this morning. He takes over for Bishop Edward Braxton, who turned 75 last year. The bishop-elect has served as the pastor at St. Raphael the Archangel Parish in Old Mill Creek, Illinois. He was born and raised in a large Catholic family in Chicago. The 55-year-old graduated from Loyola University and entered the Mundelein Seminary in 1990. A priest in the Bronx, New York, pleaded for Catholics to join him in fasting and prayer for 3 days, as the sacraments remain off limits for so many.
Spend 3 days in fasting and prayer for 4 intentions. 1, the salvation of the souls of those who have died and will die or are dying right now without the benefit of the sacraments, and in general, just those who are dying. 2, for the protection and the healing of all those who have the COVID virus, that they would recover as soon as possible. 3, for the protection of those who don't have it, that they would not be contaminated with this virus. And 4, for all the doctors, the nurses, and the hospital chaplains. And I'm asking you to participate in this ancient weapon of the church, fasting and prayer. It's true, we don't have access to the sacraments like we should, and we want to. And I'm asking you to unite with Catholics, Christians, and people of goodwill all over the world.
Father Drutting says the inspiration for the fasting and prayer came from the book of Jonah, when the city of Nineveh fasted, quoting from the Old Testament, when God saw their fasting, God repented of the evil that he said he would do. His request for 3 days of fasting and prayer ends today. Across the nation, all 50 states have reported and continue to report cases of COVID-19. And while different parts of the country are experiencing different levels of virus activity, doctors everywhere are learning more about the potentially deadly disease every day. Joining me now on Skype from New Hampshire is Dr. Jonathan Ettinger. He is a cardiologist and fellow of the American College of Cardiology, that is. He is affiliated with many hospitals in Manchester, including Catholic Medical Center. Doctor, welcome. Thanks so much for joining us.
Yes, thanks for having me, Tracy.
Well, there's so much that we're still learning about COVID-19, but we know that people with underlying health conditions may be more at risk. Is heart disease considered one of those conditions?
Yes, heart disease is, but right now we're so early in the pandemic that we don't have a good sense of what types of heart disease are more at risk versus other types of heart disease, which might be less risk. Right now we have a broad idea of risk, but I think we're waiting for more information.
I know that we're hearing that a lot of people may be asymptomatic and that they can spread the virus without even knowing it. How concerning is that to you as a doctor, especially when it comes to stopping the spread of this disease?
Yeah, because we're so early in this process, there's a lot we don't know about the virus. So it requires social distancing, the 6-foot rule, hand washing, general principles like that to keep people safe. Because without that knowledge of if I'm infected or not, it's very difficult to then know if you're going to infect somebody else, right? So it's challenging. So right now, it really behooves the public to do the right thing and stay in, and non-essential travel, those type of things.
Yeah, I mean, this has hit absolutely everywhere. What are you seeing in your state, in New Hampshire right now? And can you tell us how it's impacted hospitals so far?
Sure. So we're just starting to get into the surge, I guess. It's coming. This week, we've really started to see a surge in the numbers. Our hospital, Catholic Medical Center, had our first deaths this week. So it's been particularly traumatic this week and stressful this week. We knew this was coming, but it's just hard to prepare mentally. We prepare as much as we can in the hospital with resources and planning, but that first death has taken a lot out of the staff.
Yeah, it's really, really tragic. Have you ever seen anything like this before? I mean, have you ever been in the middle of an epidemic or pandemic like this?
You know, we see rises and swings with the flu. And I was part of the flu in 2003, 2002, 2003, but this is nowhere near this is much more severe than what we saw back then with the flu. This will probably be, for most clinicians, this will be their crucible, and most patients, this will be the crucible of their generation. It's unprecedented, and it's distressing. It's very difficult. Yeah. This will be the highlight of a lot of physicians' career, and I say highlight with trepidation. Yeah.
I know that there is a big lack of personal protective equipment, also known as PPE, right now for healthcare workers. Are you experiencing this at Catholic Medical Center? And if so, what's the hospital doing right now to try and fill that gap?
So we've had a lot of generous donors from the community. Our hospital's been able to make some purchases as well. We've had our leadership has really worked hard to keep our supply chain and our supplies up to speed. Again, this gets at what we were talking about before with people staying home and just trying to suppress the virus, and so we never have to use this supply. It's one of the reasons why we're not testing people regularly. We're only testing if you're symptomatic or if I think the test is going to make a difference. We're only bringing you in the hospital if you need to be hospitalized. There's still some confusion out there about who needs to be hospitalized, who needs to be tested. But all of that is geared towards allocation of scarce resources and trying to keep the numbers, our supplies up in case we really need them.
Yeah, I know that you're a really busy man. I don't want to keep you, but I really want to ask you this last question. As a Catholic physician, how is your faith helping you to face these new challenges that are coming up from this pandemic?
Sure. My faith is important. It's part of my strength. It's part of my character. It's part of why I work at a Catholic hospital, is because I can incorporate my faith in taking care of my patients every day. We have something simple that comes across our work email. It's a daily prayer. It's just a simple message, but oftentimes it provides hope and inspiration and reminds you of why you're doing what you're doing. So I find a lot of faith, a lot of inspiration, and I get my courage from my faith.
Well, Dr. Edinger, thank you so much for what you're doing. We're grateful. We're praying for you and all the medical workers out there, and know it's a really tough time for you. So our prayers are with you. Dr. Jonathan Edinger, Catholic Medical Center, thank you.
Thanks for getting the message out.
Up next, Pope Francis encourages the faithful to find strength through the example of Mary. Pope Francis invites the faithful to use these difficult times to remember the sacrifices made by our Mother Mary.
È la madre, nella Chiesa Madre.
At his daily Mass at the Vatican, the Holy Father says Our Lady is the mother of the Church, but she never asked for anything except to accompany Jesus, even though it brought her times of sorrow, including at the foot of the cross. And she will help us if we think of her, search for her, and pray to her. Pope Francis also releases his prayer intention for April. He is asking the faithful to remember those suffering from addiction.
Apoyados por el Evangelio de la Misericordia, podemos aliviar.
In a video message, the Holy Father says those addicted to gambling, pornography, and other vices can find healing through the mercy shown in the gospel. He also asked the faithful to pray that those suffering from addiction will not be alone on their journey to being cured. And a reminder, EWTN airs masses throughout the day. Mass airs at 8 a.m., noon, and 7 p.m. Eastern from Our Lady of Angels Chapel in Irondale, Alabama. We are also airing the Pope's daily Mass and a novena from Our Lady of Lourdes. In addition, we are offering Eucharistic adoration from 9 a.m. to 6 p.m. on our website, EWTN.com. We thank you for watching tonight. For the entire EWTN News Nightly team, I'm Tracy Sable. We're back Monday with more news from a Catholic perspective. Good night and God bless.